In a little more than a year, neighbors in Bradford County are set to have a major upgrade in emergency health care.
WETM 18 News reporter Bobby Brooks has more. Bobby.
Jeff, Rebecca, in about after 4 years of planning, ground has been broken at the site of Guthrie Healthcare System's new Troy Community Hospital.
I'd like to thank everyone for coming. My name is Staci Covey. I'm the president of Troy Hospital, and we're all very excited to have you here and have this day finally arrive. I'd like to thank the Guthrie leadership, Troy Community Hospital board members, and everyone for working so hard to make sure that the people of this region receive a healthcare facility that will enhance patient convenience, comfort, safety, and privacy. I would also like to thank all of the employees, physicians, and volunteers of Troy Community Hospital who have been working hard every day in a facility that can make their job more difficult at times, and I thank them for patiently waiting for this project to begin. Today we break ground on an exciting new project that will greatly enhance the healthcare services for the people of Troy, Canton, and the surrounding communities. The new medical campus will bring together the hospital's inpatient and outpatient services with new office space for primary care physicians and visiting specialists. All 25 inpatient rooms will be single-occupant private rooms, giving patients and family members the privacy and the comfort they expect and deserve. Technology upgrades will support the use of patient electronic health records and telemedicine, key to the success in our rural location. The medical campus has been designed and is being built on behalf of our patients. Patients are why we are here today and every day. Our mission is to provide top quality health care right here, close to home. The new hospital will help make certain we can fulfill that mission for the next 50 years and beyond. Our next guest is Dawn Volpe. Dawn and I were together a couple of weeks ago at a friend's house just talking, and she was reminiscing about the years that her father spent building the old Troy Hospital. And I thought, what a great addition to this program today to ask Dawn to come and just say a couple words.
The Troy Community Hospital has been special to my family for many reasons. My grandfather, Howard Robbins, built the old wing of the present hospital, and my father, Ray Robbins, was the contractor who built the new wing. I was a small child at the time my father built the new wing, but he was insistent that I lay the first brick. I did, and it's a tiny bit crooked, but it sits as I laid it. The term community truly describes the hospital in Troy. Being a patient there meant being cared for by friends and neighbors who knew you and your family and cared for you in a professional and kind manner. While a patient there myself as a teenager, I made the decision to become a nurse by the example set by my caregivers, as well as the fine example set by my mother.
Now I would like to introduce Ken Levitsky, the chairman of the Guthrie Troy Hospital Board.
I want to talk about the fact that one of the things that we are very aware of here is our rural location. And so as you look behind us to where we are going to be building the hospital, we feel that we are fitting this into the rural area as well as the town of Troy and this entire area. And we are just thrilled about the fact that we have this beautiful spot. And we really appreciate that the great concern that there be good health care from the people in the area, and we feel that we have been entrusted with providing that, and that this is very much a part of that.
I would like to introduce you to Dr. Carrie Wood.
Thank you all for coming as we finally begin this greatly anticipated project to better serve our hometown. In addition to the new hospital, which is what the majority of you are here for, I am here to represent the fact that we are also going to construct a new Guthrie Clinic office space. The new facility will allow our team, which is currently divided over 2 floors, to come together in one wonderful 30 exam room space on a single story. We'll be removed from the red light, the school bus traffic. We'll have more parking. In addition, we'll also be physically attached to the hospital. This will allow our patients easy access to radiology and laboratory work without ever having to leave the building or endure the weather.
And last but not least, I'd like to introduce you to Dr. Joe Scopoletti, who is the CEO of Guthrie Health.
The new Troy Hospital is being built, designed and built with the idea of three concepts in mind. The first is comfort to the patient. The second is an environment which is healing, and the third is an efficiency. Guthrie is in the midst of a transformation. The new hospital in Corning, we're building some new medical office spaces around, and this facility is yet another example of our commitment to that orientation of patient comfort, convenience, and efficiency of the care.
Construction for the new 65,000 square foot hospital is set to be complete by early to mid-August of next year. The facility will also include a helicopter landing pad for faster emergency care. Funds for the project are being paid for entirely by Guthrie Healthcare and private donations.